she has had carpal tunnel for years and finally decided to have carpal tunnel surgery, right? She is diabetic, so she has a certain amount of neuropathy already. So she has a certain amount of numbness due to time, disease process, and now her surgery, right? Her surgery didn't make it worse. Her surgery made it better. So her residual numbness will get better over time as long as I work on range of motion of her fingers, range of motion of her wrist, if I'm doing nerve glides, moving all the nerves, and I massage the scar. But numbness is one of the last things to go away, and it won't go away for good if you've been compressing it for decades, right? So again, you have to know your root cause. If someone has if someone has diabetic neuropathy, we're not working on sensation. Why? You can't change it. Because when something dies, you can't bring it back. Like, we're not Pet Cemetery. Oh my God, did I just age myself? So you have to understand the root cause, you have to understand what you can affect and what you can't affect so that you can work more effectively. But also, I'm a big believer in working with less frustration. I'm not going to work on things that can't change, right? If she has diabetic neuropathy, right, I can't change that. This woman has been, diabetic for over 30 years. And it has been progressively getting worse. So my goal isn't to address numbness. It's to address, is that tendon moving through? Does she have better range of motion? Can she pick things up better with her eyesight, using it to help her with sensation? Does she know sensory safety types of issues if she has a certain amount of numbness, like protective types of sensation, right? If I know that, then I know I'll work on the right things and not put my focus on things that won't make a big difference in someone's lives, right? And then you have to have that tough conversation with your patients because you have to manage their expectations, especially in order to justify and in order to, but also in order to, be able to, hit those goals that you want, right?